Welcome to Money Talk with Aaron Ricketts, presented by Ricketts & Associates, 3245 North Adrian Highway, Suite F. The opinions voiced on Money Talk are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, consult with your attorney, accountant, financial, or tax advisor prior to investing. Securities are offered through LPL Financial, member FINRA SIPC. Welcome to Money Talk. Aaron's with us in the studios here this afternoon. Hey, Aaron.
Hi, John.
Okay, it's October. It's always a big deal when we talk Medicare.
That's right. Exciting. Medicare. Medicare is complex. Mm-hmm. I would just call it confusing because even I've been doing, my dad and I have been doing seminars and workshops and having these conversations with clients for years and years and years. So, the Affordable Care Act came in, changed the rules, became law, which is Obamacare. And of course, there were a lot of changes, but that's been a while now. So those changes were implemented, believe it or not, 9 years ago is when that started. And there was a 5-year implementation. So 2014, 15 is when it, fully implemented. So it's been a little while since we've had this going on. So you would think that we'd get it all, right? We'd understand
You'd think.
So I had a client call me just a couple weeks ago, driving down the road, called him back, and we're talking about Medicare, and there's premium questions and stuff like that. And I'm thinking, I think the advice you got was wrong from the, Medicare, from his, when he called the Department of Aging. So I call my Medicare contact, and I said, and I got a couple of them, and I called my one guy that was there. I called the other person too, but she couldn't answer the phone. So my guy answered the phone, explained the situation, says, yeah, Aaron, that's it was the law. It changed part of the law for the ACA in the budget bill and the tax bill that was done, 2 years ago. So for the 2018 tax year. I said, are you kidding? How did I not see that, or did I miss that? It wasn't a big deal, but it was a change. It made a change.
I swear, I think these guys do this better than the CIA.
Sneaky?
Yeah.
I was amazed when he told me this, that, the plan was for this to happen in 2020, but they actually moved it up, 1 year because of the change they did to the tax law. I said, I had no idea that they made that change. So I called the client back, passed it on to him, and so everything's good. So let's talk about open enrollment for Medicare. Every year they have this thing called the Annual Enrollment Period, AEP. And that is a time when you can go in, and I'll mainly focus on some of this. I'll mainly focus on the enrollment into, enrollment and change to enrollment in your Medigap, right? That extra insurance that covers, Part B, when Part B only covers 80% of your doctor visits, diagnostics, all that stuff. So that's that co-insurance that you might have. So open enrollment for that is October 15th to December 7th. So if you've never been in and you're eligible, that's your time to enroll. And if you want to change plans, that's the time to change plans. So one thing you can do is switch from original Medicare to Medicare Advantage, or vice versa during that time. So that's something that's a little different, that they've added that. And you can switch from your Medicare Part D, the prescription plan, to another plan at that time. Remember that you'll be auto-renewed into any plan that you have, so there's nothing that you have to do. But if you're looking to switch mainly from that Medicare Advantage to back to original, or vice versa, that's when you want to make sure that you're doing it at that time. Now, they also allow you to change Medicare Advantage to original Medicare, or back and forth between January 1st and March 31st. They allow you to do that. They also allow you to enroll in that plan. So if you've never been enrolled, you can enroll in it. And you can buy your Part D. So you kind of have a couple different times that you can do this now. So that's something that has changed. Let's talk about enrolling in original Medicare. If you didn't sign up for Medicare A or B when you were first eligible, you have a chance to do so from January 1st to March 31st with coverage effective July 1st. Remember that. So even if you're saying, oh man, I wish I'd have signed up for Medicare when I was 65, let's say, and now I'm 68, and I think it's probably the best thing to do is to get some insurance coverage. I'm going to enroll. Remember, you're not going to have insurance coverage until July 1st. That's when it's going to start. In addition, you may be subject to a late enrollment penalty. So if you did not have insurance coverage through another company, and I say that maybe you were working, so you had major medical insurance through your company. If you did not, and you decided I didn't want to pay that $130-something for Part B and sign up for some co-insurance, and then because you didn't want to pay for that, you're now probably going to be subject to a 10% penalty per year. So I'm not saying that's a lot of money. Let's say it's $135 for right now for Part B. So they're going to charge you 10% more, so another $13.50. And if you were 2 years, that's $26, and that's forever. It just continues on, and it won't ever change. Just keep that in mind. I was a part of the Medicare Part D when it came into effect. I think it was 05, somewhere around there, 2005. So that was under the Bush administration. Created this prescription drug program, which is good that there was a program, but it's so complex and so confusing. But it's what we got. So,
Aaron, if you're drawing Social Security between the ages of 62 and 65,
yes,
do they automatically enroll you into Medicare, or you still have to do that yourself?
Right. They will automatically enroll you. So it's kind of nice. You'll get a notification in the mail. I've had a few clients get those, so I've seen them. They automatically enroll you, and on that line of question, you enroll in Medicare through Social Security Administration. So they have that connection, and that's how they do that. So Medicare changes in 2020. So we're coming up on it, believe it or not. I tell you, it's going to make it a lot easier when I start calculating people's ages. When we hit 2000, it was really easy, right, to calculate somebody's age. And 2010 was nice, and now 2020, thank goodness, you can, they were born in 1956, oh yeah, you know exactly how old they are. I love it. So Medigap plans that cover the Part B deductible will no longer be available for purchase for newly eligible Medicare beneficiaries. So Medigap plans C and F will be not available to sign up for. They're still going to be available for those that are in the plan, but they're not going to be available for new coverage. And they're saying that, and I say there's journalists out there, and we listen to the radio shows, and those of you out there might hear some of these advertisements that because they're not going to allow newer, often younger Medicare beneficiaries in the plan, that only the older people will be on. And of course, older people use more health care, which can be more expensive. So then prices or premium costs could go up. So keep that in mind. I know we've done some radio shows where I was kind of maybe adamant about, you need to talk to your Medicare specialists about changing plans now so there's no issues. Because changing a plan isn't as easy as what I started discussing, because it's possible that you could have some medical questions. And if you have medical issues in the last year or 12 months, it's possible they won't allow you to switch plans. So, when you're healthy, that's the time to do things, to think things through, and maybe that is time to change. There's not a big difference between plan C and F. One of the big differences is the deductible. So, one plan has a $185 deductible, and then because of that, the premium is a little different. So one is more expensive than the other. They kind of call that one of them, they call them the Cadillac plans, because they kind of pay for everything or cover a lot of stuff. And people like those plans, but they're pushing the Affordable Care Act, changed a lot of that, and they're pushing everybody into the same plans. The donut hole is being eliminated in 2020 for generic drugs. So this is one of the changes that happened from the tax bill. that was snuck in there, which is a good thing. They put it in there and moved up 1 year the brand name drug deductible, or I'm sorry, the donut hole. So this has been something, I think, even 5 years ago when I was talking about this, I said, you know how much money this is going to cost the government? They're probably going to change this. Well, they haven't. If anything, they solidified it, when they passed the tax bill. We'll see what happens, but so far they're just eliminating that donut hole. When I say eliminating it, there's still a copays inside that donut hole for people that have Part D, so it's not going to be zero. But then when you get past a certain number, which is, and I know I'm going to see it here, $5,100. When you get past the out-of-pocket expenses, and I know there's somebody out there that has really looked deep into this because, they've had a lot of out-of-pocket expenses. They're going to tell me we spend a lot more than $5,100 before we got out of that donut hole and got into the catastrophic coverage. And I'm with you. It's very complex and confusing. Just know that you do get out of the donut hole at some point. And according to, the numbers that the government provides, it's the donut hole is between $3,800 and $5,000. So once you get past there, then you're in the catastrophic coverage, and then it's typically about 5% is your copay. It's pretty good.
Yeah. Sometimes they don't tell you that donut hole is black.
It's it's like a giant sucking sound. Hate that. So again, brand name drugs and now the generic drugs will be eliminated as a part of that donut hole. So that's good. It makes it a little easier on the rest of us. It's easier to explain when we have that conversation. I used to be neck deep in all this stuff, and I tell you what, it took half my time just to understand that. So I leave it now to those that are specialists just in that area, and I suggest, and I've said this many times, if you have questions about your Medicare or your Medicare supplement, talk to a local agent, somebody or somebody you can trust, somebody you can be referred to. You don't pay anymore. The plans, and used to be an issue about compensation, what the salesperson, was compensated. It's pretty much even now. So original Medicare, if you're on that and you go through an agent versus Medicare Advantage and see an agent, it's about the same price or compensation that they receive. You are going to pay no more or no less if you call somebody on a phone, the advertisements you see, the 800 numbers, for the big major companies. Local people, Medicare agents use those same companies. So I tell people, you're talking to an agent when you call, so why not talk to somebody local? And then if you have issues or questions, you have somebody right there. I've worked with 6 or more local agents. They all know their stuff because that's all they do. They're focused on that business. So I'll quit talking about that. All right. Medicare Part B premiums are increasing slightly. They're mainly staying the same for most people. They'll go up for some, but that number is $135.50. So everybody pays that. That's on Part B premium, unless you're low income. And I'm telling you, if you are very, very low income, you need to be talking to Department of Human Services, Department of Aging, to see about getting some extra help to cover some of that stuff. So if you know somebody that is low income, when I say low income, I mean maybe even under $14,000 a year. So that's pretty low. And that's, assets are counted and all that's kind of complex, but they'll walk you through that and work with you. But if somebody's very low income, you want to talk to them or have them talk to somebody. So that really didn't change much. And I think the major point that I want to make about Medicare is that when I was involved in that Medicare Part D when it first came out, because I wanted to help clients, because several of our clients didn't have prescription coverage, right? And this is a new coverage and it's an option, and I want to see what the premiums are and the types of plans, and went through all that. So I learned that what I found is not our clients necessarily, but people they referred to me, talking with them. I had probably 6 out of 100 people that I talked to, and I even wrote their names down because I wanted to call them, years from now to see if things have changed. They did not have Medicare Part B. They didn't enroll in Medicare Part B when it was time for them to do that. And I think one was in their 60s and the rest were in their 70s. And I was just really shocked about that. And the reason they were going to enroll in the prescription coverage is because that's what was costing them the most money. When they went to the doctor back then, it was, $50 or less to see the doctor for their doctor visit. So they go once a year. They get their 1, 2, or 3 meds, their heart meds, their blood pressure, their cholesterol meds, the stuff that all of us are on, or most of us are. The doctor visit didn't cost much. It was the cholesterol med, or it was the heart medication. So they were more focused on, let me see, if I pay, $15 a month for prescription coverage, that might cover a lot of that, So I was always, I'm still shocked that people don't want to pay for that. And it wasn't that they couldn't afford it because, if they were low income, the government will pay for it. But everybody else, that can afford it should have insurance. They should pay that. We should pay it all into a pool so we're all covered.
Absolutely.
I think it's important.
And it's important to talk to somebody. It's a complex issue.
Yes.
So
yes.
There's a number they can call.
Well, give me a call, and if I can't answer it, I'll refer you or I'll get an answer for you. Call me 265-3540.
Thanks, Aaron.
Thanks, John.
That's Money Talk with Aaron Ricketts, presented by Ricketts Associates, 3245 North Adrian Highway, Suite L. The opinions voiced on Money Talk are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which investments may be appropriate for you, consult with your attorney, accountant, financial or tax advisor prior to investing. Securities are offered through LPL Financial, member FINRA SIPC. Join us once again next week for Money Talk here on 103.9 WLEN.